Whoa!
To see 11-year-old Lucy Wright at a playground is to see the joyful, full of fun girl that she is. She loves school, her friends, and of course, her phone.
I do some dances, and I also love scrolling through my friends' TikTok.
But Lucy has come all the way from England to receive specialized cancer treatment. She was diagnosed with neuroblastoma 3 years ago, a pediatric cancer of the nervous system.
She's a happy child, she always has been, and to see her in so much pain was really difficult.
Lucy and her parents went all over England for cancer treatments, but knew they needed to bring her to Charlotte.
And as parents, we just want to give her every opportunity of not relapsing and getting on with her life.
High five. Nice, way to go, you are strong.
And that's where Dr. Giselle Sholler comes in. Sholler is an internationally recognized pediatric oncologist known for her groundbreaking research. Parents like the Wrights find their way to her. The Wrights have fundraised for 2 years so Lucy could begin clinical trial drugs with Sholler.
The work that she's doing is exclusive to the States, so we had no choice but to come.
So lots of different treatments. We've travelled all over the UK to get to this point, and now obviously we've come to the US to fix it once and for all.
In the last 10 years, Scholler's work has helped to improve the survival rate of neuroblastoma from once 35% to now up to 70%.
That's really the power of research. It brings hope that we can do better and do more, and we're seeing that happen.
With the partnership of Atrium Health Levine Children's Hospital, the Isabella Santos Foundation, and the Beat Childhood Cancer Foundation, Scholler's work is now headquartered in Charlotte and joins the cancer team here.
The Levine Cancer Institute has a huge program for adult cancers, and now we can work with them and to expand that into pediatric cancers. Beyond just neuroblastoma, we're now doing pediatric clinical trials in all solid tumors.
We've been able to now tie in the clinical piece of seeing all the patients to the science piece of all of that. And so those two things together for pediatric cancer is how we should be doing things. So I do think it's a game changer.
All right, you have a safe trip back to the UK, okay?
She adds the work now includes a new treatment pathway called the Precision Medicine Program.
So now every child that's diagnosed here in Charlotte at our hospital will have their tumor sequenced, full genomic sequencing of the patient's tumor to really understand more about the biology of each individual child.
Colleagues like Dr. Javier Osterheld say it will be transformational.
Instead of targeting where the tumor is, you're targeting actually the genetic code of the tumor, which I think is the future of cancer care, which is where adults are today.
Get one right there, Bryn.
3-year-old Bryn Andrew is the perfect example of what precision medicine can do. The toddler from Albemarle was diagnosed with neuroblastoma in December of 2018.
And then it was just boom, boom, boom. Within a couple of days, she had her biopsy, and then we knew it was neuroblastoma, and then, she started chemo the day after Christmas.
It's just part of life. She loses her hair. That's who I came home from work or go visit at Levine's or stay with her up there. That was our bald little Bryn, but that was our daughter, and it was our normal at the time.
Bryn and her brother Nash play in the backyard. Dad blows bubbles to add to the fun, and Mom Kelly sharing this news.
She is declared cancer-free. We're so happy and so excited. Her most recent scans were completely clear scans, first time she's ever had clear scans since we started all of this.
A lot of tears. A lot of, self-reflecting on ourselves, on our relationship, or on our family as a whole. At the end of the day, I think we came out stronger.
It's really easy to be down and to look at everything bad, but if you sit around and look at everything that's good, you really do see so many wonderful things in life. It makes a huge difference when you have that attitude. It really does.
When you see the Andrew family, it's hard to believe what they've gone through. But their daughter is proof of what pediatric cancer treatment in Charlotte can now do. So now their precious daughter can enjoy life's childhood milestones, such as learning how to pump her legs on a swing.
Pump, Bryn, and Nash, pump.
So for families like the Andrews in Albemarle and the Wrights from England, The pediatric cancer treatment here in Charlotte has been transformational, and this new work will continue to help children both here and from around the world. For Carolina Impact, I'm SUZETTERHEE reporting.
We hope you enjoyed the story. If you don't want to miss any more great stories about the Charlotte region, please subscribe to our YouTube channel.